And welcome to today's ECHO session. My name is Sydney Fleming. I am the Outreach and Community Engagement Specialist for the Constellation Regional Collaborative, and this ECHO series is one of our key program lines. I'm joined today by Kathleen Wellman, who is our program coordinator and ECHO lead, and I am taking this ECHO on. So this is my first time, so we'll see how it goes. I'm kidding, it'll be great. So Kathleen's going to be supporting the chat throughout the session, so if you have any questions or anything like that, she'll be able to get that handled for you. So thank you again for joining us. We're excited to dive into the discussion today. We're going to start off with looking over our agenda. So we're going to start with a quick round of introductions to see who's in the room, and then we're excited to welcome Timothy Martin and Sarah Sawaya. Did I say that right, Sarah? Great. From the University of Mississippi Medical School for our didactic presentation. After the presentation, we're going to open up the floor for questions and discussion. We really are encouraging your participation here. That's really where the power of ECHO comes in, is that discussion through peer learning and sharing across all the disciplines that we see in the room today. Then we're going to talk about our next session, and then at the very end we'll have a post ECHO survey, and that's going to help us continue to improve on these ECHO sessions and tailor the next sessions to the needs of our audience. All right, so let's go ahead and get started with introductions. These are our awesome ECHO series subject matter experts who are helping to guide the learning and share insights and elevate the community-informed solutions throughout this series. So let's see who's with us today. We'll start with Dr. Jeffrey Bretler. He is a practicing physician with deep experience in chronic disease management. Hey, Dr. Bretler.
Hi, good afternoon, everyone. I'm an internist with the Kaiser Permanente system in Southern California, where I help co-lead the hypertension program there. I'm also a consultant for the Hearts program and with the Pan American Health Organization. Glad to be here.
Thanks, Dr. Bretler. We also have Dr. Emily Ridley. She is a pharmacist representing the pharmacy perspective in team-based care.
Hi, hello, everyone. As Sydney said, I'm a clinical pharmacist. I'm based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where I serve primarily low-income, urban, but also many rural population of patients. I've worked with our health system in quality improvement efforts regarding hypertension control, and also worked some with the Hearts in America program. Thanks for having me.
Thanks, Emily. Next we have Dr. Don DePetty.
Well, thank you very much, Sydney. Don DePetty. I'm the Health Sciences Distinguished Professor here at the University of South Carolina and School of Medicine. As Dr. Bretler, I've had a long career in hypertension, both the pharmacologic treatment of hypertension and some basic science studies of hypertension. And I also am an advisor to PAHO and the World Health Organization for the Hearts program.
Thanks, Dr. DePetty. We don't have three of our subject matter experts with us here today, but on our team we also have Honey Estrada, who is a community health worker. We have Dr. Lackland, who is a leader in hypertension and cardiovascular health and research, and Monty Robertson, who provides expertise in systems level implementation and healthcare quality improvement. I think Kathleen already put it in the chat, but if you're here in our audience, we'd love to see where you're coming from. So if you'll share your name, your employer, organization, and your position or credentials, just so we can see who's with us today. Thank you. All right. Come on, computer. There we go. All right, now I'm excited to introduce today's speakers. So first we have Timothy Martin. He's now a third-year medical student at the University of Mississippi Medical School, originally from Laurel, Mississippi. He's interested in a career in internal medicine and some other specialties that we just learned about earlier, and pediatrics. So over the past year, he's served as director of the Student Health Coalition's nutrition team, where he's enjoyed educating patients about the role of good nutrition and healthy living, often through engaging food demonstrations that make healthy eating accessible and fun. We also have with us today Sarah Sawaya. Um, she is from Madison, Mississippi. She's been involved with the Student Health Coalition for over 2 years, driven by a passion for serving communities and promoting preventative health. Her work has strengthened her commitment to health equity and expanding access to care. Sarah plans to pursue a career in surgery where she hopes to continue making a meaningful impact. So we're excited to have our speakers today, and I will pull up their presentation really quick and turn it over to them.
Awesome. Thank you so much for having us today. And we are super excited to be here and be able to share this information with you. Like she said, I am the nutrition director still for the Student Health Coalition, which if you weren't here at our last session, the Student Health Coalition is just an organization that's run by students at the University of Mississippi Medical Center, focused on bringing healthcare information and screening techniques and food demonstrations to underserved areas within the state and hopefully broader in the Southeast and the years to come. And so the role that I serve as the nutrition director is like she said, getting to lead food demonstrations as well as educational opportunities for kids and for adults to learn more about eating healthy and how they can do that, which you'll learn a little bit more in this presentation today. So I titled this presentation, Early Foundations Shape Future Convictions, because I want to talk about approaching the South's childhood obesity and diabetes epidemic by starting at the ground up, starting at the habits and moving onwards, because those are where these changes have to occur. If we're going to start with the kids that are struggling with these things, we've got to start with their habits that they're building now. And so today we're going to talk about a little bit about that problem, as well as discuss some of the changes that we have been making already, and then kind of where we're going towards the future with our organization. So if you want to go on to the next slide, this is kind of our roadmap. So first, we're going to discuss the rising tide of weight within the United States, and specifically in the Southeast as well. And then if that rising tide is not curbed, some of the future outcomes that can display in kids' lives as they grow up to adults, and some of the conditions that they have to deal with if weight is not taken care of at an earlier level right now. And then Sarah will take over and she'll talk about some of the things that we are doing within our state and our community to be able to pull up this problem by the roots right now, be able to start at the ground up. And then ensuring a change that lasts is really just focusing on what we're doing going forward to be able to ensure that things that we're doing are sticking in our communities and our families across the states. So we can go and go on to the next slide. So before we begin today's talk, it's important that we define two conditions. And the first is childhood obesity, and the second is type 2 diabetes. So the CDC defines childhood obesity as having a BMI at or above the 95th percentile for age and sex. And the American Diabetes Association defines type 2 diabetes as the body's improper use of insulin to keep blood glucose at normal levels, also known as insulin resistance. But why define these two conditions for y'all today? Because we are currently on the edge of an ever-rising tide, increasing prevalence of both of these conditions in our most vulnerable population, and that is children. So you can go on to the next slide. So shown here is a chart from the CDC illustrating the rising tide of obesity in the United States over the last 50 years. Noticeably, a 15% increase has occurred in children and adolescents since 1970, and that number only continues to rise. That means 1 in 5 children and adolescents in the United States have obesity, which is equal to 14.7 million youths aged 2 to 19 years old. As this chart illustrates as well, the rates of obesity only increase as you move from one category to another, with adolescents aged 12 through 19 having the highest rates at 22.2% within that age range. However, as these trends increase across the younger ages into adulthood, there are disparities as well littered across other demographics too. You can go on to the next slide. So the most glaring differences that were found were in the areas of race and ethnicity, sex, and the size of one's family income. So in regards to race and ethnicity, obesity prevalence was highest in Hispanic children at 26.2% of the United States, followed by non-Hispanic Black children at 24.8%, while notably non-Hispanic white and Asian children were over 10 points lower at 16.6% and 9% respectively. So in the sex stratified data, obesity prevalence was highest in non-Hispanic Black girls and highest in Hispanic population for boys. And lastly, in 25 years, obesity has had a negative correlation with family income within the United States and continues to play a huge role in determining the meals that families have access to. As household income decreases, health grocery options decrease significantly, making this a recipe for disaster for many American families trying to prevent obesity from their very own kitchens. Yet, how does this rising tide of weight impact our home state of Mississippi and the Southeast? You can go on to the next slide. So sadly, like many of our other healthcare issues, the Southeast is considerably impacted by issues like childhood obesity. Sarah and my home state of Mississippi is second highest behind Kentucky in rates of childhood obesity at levels of 22% of our population of kids aged 10 through 17. In addition to this, 23% of Mississippi's kids aged less than 18 years old struggle with food insecurity, meaning that they do not always have a safe and stable way to procure healthy meals for themselves. While socioeconomic status and geography does play a major role in our states, another factor that many people forget about is simply that good old-fashioned Southern culture. You can go on to the next slide. So I'm not here to hate on Southern culture or the food that comes with it. I'll be the first to come to the table when my mom brings out her mac and cheese and collard greens and mashed potatoes. However, the tendency towards Southern culture to fry everything that is dead and living and serve it with a side of ranch predisposes many to higher rates of obesity. According to Dr. Ivan Porter of Mayo Clinic, quote, in a traditional Southern diet highlighted by fried foods, processed meats, egg dishes, sugar-sweetened beverages, and bread, the prevalence of high blood pressure and other chronic disease is immensely higher, end quote. In addition to the food, a large part of our culture is one that consists of a sedentary lifestyle. Hospitality that extends to the dinner table often extends to the front porch and the couch for SEC football. And social gatherings where the main event is a meal and the entertainment is the conversation. Lastly, soaring high temperatures and even higher humidity creates a tough environment to get outside and be active. Complicating this, there's also a shortage of places for outdoor exercise to even be feasible. Contrasted with areas like Colorado, where the weather is often more temperate and there are abundance of places to hike, snowboard, and you name it, other activities that can be done outside. And while I would never give this culture up, as it is my own, it is a risk factor for chronic disease in children that cannot be ignored. So it seems like the odds are stacked against many of our citizens. Childhood obesity rates have made a slow and steady climb up towards drastic levels. But what does that mean for the future of our children? You can go on to the next slide. So obesity in our children means higher rates of many conditions that can be devastating to deal with later in life. The first of these is metabolic syndrome, or Syndrome X, which is a cluster of conditions such as hypertension, diabetes, and obesity that together contribute to higher rates of heart disease and stroke later in life. Another condition is dyslipidemia, which is an elevated triglyceride and free fatty acid level with a decrease in healthy HDL. Additionally, those with childhood obesity have a 4 times increased risk of glucose intolerance and type 2 diabetes. And over 85% of children diagnosed with type 2 diabetes are concurrently also overweight or obese. So those high levels of insulin ended up leading to elevated levels of sodium retention and sympathetic activation, which leads to the next future outcome of hypertension. The most influential risk factor in pediatric hypertension is a high body mass index. The adipocytes, which are increased in children who are obese, increase the levels of molecules such as leptin, resistin, and interleukin-6, which are all pro-inflammatory molecules that increase sympathetic tone, leading to long-term increases in blood pressure, putting unnecessary strain on the vessels and organs of the body. And lastly, and not to be overlooked, is low self-esteem and depression that is rampant in these kids. Children who are overweight are more likely to experience these issues when they reach adolescence, which can often trigger emotional eating and trapping these kids in a perpetual cycle. Many studies have even shown that rates of anxiety and eating disorders are much higher in those kids that struggle with obesity as a child. All that to say, the weight of being overweight is certainly a heavy one that we have seen already too many children struggle with. So is obesity in children any different than obesity in adults? Can move on to the next slide. So as many of you may be aware, the way that fat is added to the body is different depending on what age group you're in. So from the ages of 2 to 18, the process of hyperplasia dominates cell growth, meaning that when fat is stored in the body, it's stored as new cells with new divisions and new cellular contents. After adolescence is passed, however, hypertrophy dominates cell growth, meaning that individual fat cells balloon out in size rather than increase in individual numbers. While at this time, this style of growth is beneficial for the body to have a reserve in energy in adolescence, it can play a detrimental role if the balance between caloric intake and output is not maintained. As is the case with childhood obesity, where fat cells increase in number, and then when adolescence is reached, that increased number of fat cells begin to balloon out in hypertrophy. Now, the real problem with all of this is that when weight loss is attempted, the numerous studies have shown that it is more difficult to lose fat cells completely than to prevent their further hypertrophy, making kids with obesity more likely to regain the weight that they have attempted to lose when they try to lose it later in life. This puts kids with obesity in a game that they are made to lose. So what are we going to do about it? Sarah, if you'll take over.
One thing we know for sure, habits start early and they stick. The way a child grows up thinking about food, movement, and health shapes how they take care of themselves for the rest of their lives. That's why it's so important to reach kids while they're younger. If we can make healthy habits fun and familiar early on, we set them up for better health as adults. It's not just about what they're eating today, it's about laying a foundation that lasts a lifetime. You can move on to the next slide. So what are we doing right now? So currently we're doing cooking demos, which we have one upcoming on August 2nd. We're partnering with the Jackson Free Clinic to do it in the clinic in the patient waiting room. So patients, while they're waiting, can watch students do the demos and try the recipes themselves. And our nutrition team is adding the macronutrients to Dollar General Cookbook recipes like carbohydrates, fats, proteins. So people using those recipes know all the specific details. We've also added science and pediatric clinics, as well as the Jackson Free Clinic of the Dollar General Cookbook QR code in the patient waiting rooms and in the rooms we see patients. We also have school and church events that get families involved, such as the one on the right in the picture with Timothy and Austin. So that is our snack sort game. And it's helping kids learn to categorize foods as anytime versus sometimes. And it's a fun hands-on way of doing it that kids understand. So in the baskets in the picture to your right, there's a slow and a go basket. The go basket is foods you can eat anytime, like fruits, vegetables, or water. And then the slow basket correlates with sometimes. So fried foods, soda, and candy. So kids can put each little plastic piece of fruit or, soda, fries into the basket and they learn, healthy habits. And we can correct them if they think, one is supposed to go in a basket and if it's wrong. So it's a quick way we can teach them and they understand the game. We also are printing out our QR codes on laminated like 2x2 inch little cutouts of our Dollar General cookbook to distribute at these events and to medical school students to hold in their badge holders. So when they're seeing a patient and the patient's interested in the Dollar General cookbook, they can just get out their badge holder and they can scan the QR code and the Dollar General cookbook's right there and they can swipe through it. And we encourage families to keep these on their fridge. So if they don't know what's for dinner, make for dinner, they can just scan it on the fridge and look at those recipes as well as in their wallet while they're shopping. So they can look at, ingredients they need or other things. You can move on to the next slide. So I'm going to go back a little bit to the Oxford chapter. So the Student Health Coalition has undergraduate chapters at most of the colleges around the state. So I went to Ole Miss and I was in the ambassador program since February 2023. I graduated this May. So most of my college time I was in the SHC ambassador program, which is great. And we had community health fairs once every year, just about. And the place we did at was CP Webb neighborhood, which is one of the underserved neighborhoods in Oxford that doesn't have the financial resources to afford nutritious food or hygiene products or essentials that every human needs. So we aim to, collect all these resources and bring them to them every year. So they had those for the whole year to survive off of. And to the right here is the My Plate grocery store bingo sheet. So this past year at our health fair, I wanted to create a kids corner to get kids involved in educational aspects. So they weren't just, following around their parents, they didn't get bored at the health fair. We got them involved and we educated them about nutrition needs. So I was scrolling on the USDA website and I found this grocery store bingo that these kids, we had them printed out. They could take to the Dollar General when their parents are using our Dollar General cookbook, and they can learn about all these food groups while they're at the store with their parents and make it a fun game. And we also had coloring sheets to teach food groups for the younger children. So it had like fruits, vegetables, grains, all those in coloring sheet forms. And there's also a ton of other resources online to utilize for other events. And we also had produce distribution, which was a great aspect of our events to bring that fresh produce to that neighborhood. And we actually had the farmers that grew and transported that produce to our event. So the children could ask all these questions that maybe their parents don't know about this produce, like, how long does it take to grow? Why is it this color? So they could learn all these details about vegetables and produce from the farmers themselves. And the parents would be at the same table picking up the produce too. And you can move on to the next slide. I'll do the other point there. So one of the most impactful parts was our recipe samples and take-home bag station. So those are the middle two photos right there. We have our rainbow fruit cup on the right and our no-bake peanut butter cookie balls on the left. So that was a very impactful part of our health fair. Families got to try these healthy recipes on site. And if they liked them, they could take it home in a pre-packed bag with ingredients and a recipe card to recreate the meal together. Our goal was simple, to get parents cooking with their children. Children mirror what they see, and when they watch their parents making and enjoying nutritious meals, they're much more likely to try and accept those foods themselves. The family is one of the most important units of community, and we wanted to create an experience that brings families together around healthy food in a fun, hands-on way. And so the picture on the left side, that is Betsy Chapman, the head of the Oxford Community Market, which is the farmers market that our health fair was partnered with some of the leftover produce that was about halfway through the health fair, and our almost ambassadors are around her. And the picture all the way on the right is some pamphlets that we made at the nutrition table. You can move on to the next slide. So what's next? We use the APA Childhood Feeding Questionnaire to better understand parents' attitudes, concerns, and practices around feeding their children. And right now we're updating it. So we're taking out some questions that may be a little outdated. We're trying to shorten it so we can use this questionnaire while parents are there at our events, so it doesn't take too much time and that we have time to talk with them one-on-one if we have questions about certain questions on things or habits, the feeding habits of their children. And we can also use this later on and compare it. Maybe like a few months later, we can have them do the questionnaire again and compare it with old habits and see how it's changed over time. And we are starting the Med Elementary program to use at local elementary schools. So this program is from the University of South Carolina, and we're hoping to do it here as well to expand it. It's designed to teach elementary school kids about their bodies, things like the organs, body systems, and what happens when we eat. The pediatric committee of SHC will help run it, and the nutrition team will focus on the healthy eating part, teaching kids about digestion, balanced meals, and making good food choices. This program also introduces them to careers like nutrition, pediatrics, and gastroenterology to help them see what's possible in the future. And our goal is to help kids understand how their bodies work and how food plays a big role in their health. So the bottom two bullet points, we're also thinking about fundraising for seasonal produce and leading fun educational activities like food sorting games during distribution, hosting maybe 2 to 3 health fairs every year in underserved neighborhoods, timed around spring, summer, and fall harvest to highlight seasonal fruits and vegetables sourced from local markets around the state. And then we can teach kids more about fruits and vegetables since we're doing it around different harvests. So they're exposed to all different types and they learn, why certain vegetables grow in these seasons. So just more detail to teach them. You can go on the next slide. So next, educating the next generation of physicians. One of our goals is to make sure future doctors feel confident talking about nutrition with their patients, especially in a way that makes sense for real families. At SHC, students get to practice having those conversations early. learning how to give advice that's not just accurate, but also realistic. And then going back to the point about the QR codes that are in the badges, that also gives students confidence because they can pull up the Dollar General Cookbook there and they'll have details about the recipes to explain to patients. And we've also spoken with the family medicine residency program here to discuss how doctors, especially in pediatrics and internal medicine, can better help families with nutrition. Right now, a lot of clinics focus on the DASH diet, which is great in theory, but it doesn't always work for everyone, especially families with fewer resources. Some can't afford those ingredients or don't have access to them since they live in rural areas. That's where the Dollar General Cookbook comes in. It's simple, affordable, and offers another option that's actually realistic for patients. And there's so many Dollar Generals in the state, it's an easy way to utilize the Dollar General Cookbook, and people are located all around them, especially in rural areas in Mississippi and the Southeast. By using tools like this and having honest, helpful conversations, future doctors can be part of building healthier habits starting in childhood and lasting for a lifetime. You can move on next one. So to come full circle about this, all this happens because of community collaboration. Oxford Community Market is a great example with the Ole Miss Ambassador Program. They've worked with them ever since SHC was brought to Oxford in 2022, so they've had a few years already of building that foundation in partnership with them. And I want to talk about a model that we could possibly bring to other parts of Mississippi and maybe other states. So the produce distribution at the health fair was made possible by doing a raffle where we raised about $600 in our raffle and donated that all to the farmers market. And the farmers market then purchased that fresh produce from farmers that work at the farmers market and are in Tupelo. And we got about 369 pounds of leafy greens and then 20 dozen eggs and 20 honey bears. So there was so much fresh produce given away. And it was a pretty simple model, the raffle, finding a farmer's market that will work with us, and then having that health fair. And the kids got to get involved too, which is great. And investing time and resources to bring this model to other farmers markets across the state could expand our outreach. And combining also that snack sort game with it would also get kids more involved as well and keep our efforts rooted in community collaboration. Yeah, that is, and then we're excited.
Awesome. Do y'all have any questions or anything for us?
Thank you too. We'll open up the floor for any questions, comments, discussions. That was really awesome. I think I saw Rebecca put in the chat, I would love to play bingo while grocery shopping. That's a great idea. I know. Maybe adults should do that too. Make something that's mundane a lot more interesting.
Hi, this is Jeff. Great presentation, very innovative program, and love how you guys are thinking upstream. Any outcome data that you've generated so far in terms of follow-up of these children? How many have been through, and are you seeing any persistent changes in lifestyle? Thanks.
As far as the perspective from the farmers market that we've been doing, we just started that this summer. And we are seeing a lot of the same families come through and get to talk with us about the changes that they've done in their like kitchens and stuff, but it's not stuff that we have hard data from because we don't have an actual, form that they can fill out, which is a little bit what Sarah was talking about, the child feeding questionnaire, trying to modify that where it can be like a 5-item questionnaire that they could fill out when they come to our booth, because we don't want to take too much of their time, and something they could do quick and say, okay, yes, I do notice that I'm, my kid is having this many snacks per day or this many desserts per day, and kind of be able to track it from there. The most difficult aspect is always outcome data with a lot of this stuff, because we do a lot of work with the free clinic. And so the patients there as well, they have follow-up appointments, but we can't always follow up with them on this every single time. And so, because they're coming for their healthcare needs, and So it's very difficult to see the same patient twice or to see the same person twice. But with the farmers market, we've noticed a little bit more of that. And Sarah might be able to speak a little bit more to the community outreach events in that regard.
Yeah, so for our community health fair, this was the first year we did have that kids corner, but compared to past years, I would say we had a lot more, kids wanting to come out and interest in learning. They actually sat down and listened to the farmers, but we don't have any hard data on that at the moment. My thesis was around community health, so I did have like a few surveys. So I think right now, like I would have only survey data, but I think if we had more health fairs, we could definitely, have a questionnaire, like have numbers on how many kids came up to the table, or other data like that.
Great, thank you.
Just to add to that discussion, I really appreciate all that you're doing to start with children. As you said, that just lays the basis for how we're going to behave as we grow into adolescence and then adults. We have this across not only the South, we have these issues not only across the South, there sometimes some of the issues are worse in the South, and in the Southeast, but having ways to scale this incredible work, publish it. You're probably already doing some of that, but once you have some some data, particularly to publish it so that you can scale it across the South, across the Southeast, and eventually across the nation, because as a United States, we have some of these same issues, particularly in rural areas where it's really hard to get fresh fruits and vegetables and difficult to afford. So I just commend you for your great work and hope that I see it scaled more and more beyond Mississippi. So thank you.
Thank you. Yeah, we've gotten to take it to some research conferences already, but most of the data that we took was based off of food and health outcomes with access to care, because that's something we could pull with the people that were coming was, how many times per week are you struggling to make ends meet as far as bills go and trying to find healthy food. And so it was more focused on food deserts and food insecurity as a current problem and assessing where we're at. But as far as using this as a model, that's something that we definitely want to go forward and continue to be able to standardize in some ways. Because even the Med Elementary program that we received from the students at the University of South Carolina, they've done that well, where they kind of have a good package available to be able to share to people and say, this is what you can take, and now you can go and use it somewhere else. And I think kind of having a model to work on for that would be a good idea for sure.
Excellent. Thank you. I'm going to keep looking for your names in your publications.
Awesome. Thank you.
We did have a question come in through chat. It's from Iris. So she says, thank you. Do you have ideas on how to address children living in a homeless shelter? We provide heart-healthy frozen meals for adults as part of our pre-diabetic program. What would you suggest for children?
Okay, so that is a great question. And it's something that I think our Dollar General cookbook is very geared towards addressing, because every item that you can find in that cookbook is something it's not a fresh item. So it can be preserved. It can be something that's frozen or canned. Most of them are canned goods. And so we're able to use those already when we do like food demonstrations. We don't have to have a cooler or anything. Like, we can make everything there because it's all from canned goods. And so I think something along the lines of kind of what Sarah was doing with Oxford Community Market, where you've got these meals kind of going out in bags to people coming by, but they could all be ingredients to make one of those items from the Dollar General Cookbook, or they could already be made, like the fruit the fruit cups that they were doing or the peanut butter balls that they were doing at the markets. But I feel like that is a great the Dollar General Cookbook is a great way to do that because those items are already something that can be found at a dollar store in some ways.
Yeah, and yesterday, Timothy and I were talking about maybe gearing some recipes toward children. So that might be in the works too with the cookbook, like a kids section as well, like a more kid-friendly one.
Yeah, like I ideally have like 4 or 5 recipes that are things that could be made very quickly that even the kids could help their parents make if that were the position that they were in, as a section of the cookbook, because most of the cookbook now is just broken down by breakfast, lunch, dinner, and snack items. And so I'd love to have one that's just kind of devoted towards kids being able to make these meals, or moms making these for kids going to school is like the population that I want to definitely hit on, because that's something that they're doing every single day that we could, I feel like, utilize, and they could have a quick and easy recipe to be able to do that for their kids.
Great, thank you.
Thank you for your question.
I have a quick question actually. How do you guys run into parents that have picky kids or kids that don't like fruits and veggies? Like they've tried to give it, and they just don't want to eat it. Do you have creative ways of getting kids to eat the nutritious foods that they need to eat?
Yeah, I know we ran into a few at the farmers market that I helped work, like where I was trying to get them to encourage, what's your favorite vegetable? And they just couldn't name one, and so the first thing was to try and find like one out of each I like food group. Like a lot of kids love green beans. They might hate like all the other vegetables, but they might like green beans. And so try to find that one that they can eat or they do enjoy eating, and encourage them to continue to have that as part of all their meals. But then another solution that a lot of parents have told me that they're doing is trying to like blend those items up into like a smoothie or something like that that they can give to their kid, and they may not taste. Like, for example, spinach is a great nutritious thing that most kids don't want to eat, but it doesn't really provide extra flavor to a smoothie. But you can add it and it can be something that they can get those nutrients that they need in through a drink that still tastes good, and has good flavor to it. And so several of our items in our cookbook are smoothies already, and they try to take advantage of that, where they can kind of incorporate some of those fruits and veggies into a smoothie form. So.
Thank you.
I have one last question. So just kind of following up on what Sydney asked, what would you say is are some of the challenges or the main challenges with implementing this program?
So the big 3 challenges that we run into the most is cost, access, and time. Those are kind of the 3 areas that most of the families struggle with to be able to cook healthy foods for their kids, especially in states that do have a large predominance of food deserts. So cost mainly being that it's too expensive for them to go and get groceries. And that's where we've tried to alleviate that, is by taking advantage of Dollar General's model of trying to provide very inexpensive foods. The next is access. And so with food deserts, many times they don't have access to a Walmart or a Whole Foods or a Kroger, but Dollar Generals are everywhere. And so that's kind of where we've tried to alleviate that, is that Dollar Generals with their model have specifically chosen rural areas to put businesses at. And that's kind of what they've gone. They've tried to limit the space between one grocery store to the next by having a Dollar General in the middle, and kind of help those families be able to have quick access to that. And then the last challenge that we face most of is time. Parents just don't feel like they have enough time to be able to make meals for their kids. And so one of the ways that we've tried to address that is through the Dollar General Cookbook's parameters of when we take a recipe in from our ambassador group, is we kind of screen it. We make sure that it doesn't meet a certain cost of over $4 per serving, and then they have a time aspect of it cannot exceed 30 minutes of preparation. And so most of them are well below that, but that's just kind of a barrier that we've set so that parents don't feel like they're preparing these long meals as some can take for kids. And then the access aspect is kind of what I hit on with the Dollar General already. But those are the three things that I feel like we struggle with the most with parents is cost, access, and time.
I just have, excuse me, one quick thought, and maybe you've thought about this already, but one of the tactics that we've used for some similar work in North Carolina, as you're thinking about expanding the Dollar General Cookbook, is if you do a kids section, is maybe have some, fun. It's almost like storytelling incorporated in there and have like some coloring. Because if
I
you
love
can get
that.
the kids really involved in that, make it almost like a little storybook, coloring book, then they turn around and educate parents and grandparents too,
Yeah,
from what they learn. And it's like, well, maybe we could have this, or maybe we could do this. So it's, the kids are turning around and educating the adults. If you can incorporate something fun like that, in addition to the recipes. But it's just an idea that I've seen
yeah.
work really well. And it's amazing how, and then the kids turn around and educate the adults, and they actually start, doing what the kids are advising, and, can do it multi-generational as a family.
I love that idea. That's definitely something that I just wrote down so that we can maybe incorporate that when we do have that section added to the cookbook. So thank you for that.
Yeah, of course. Thank you.
Thank you guys for presenting it. I think it was very interesting information and wonderful that you're targeting the children and the challenges with that. I think also two-pronged, you're hitting the adults with that. I talk to so many adults who won't eat vegetables or have distaste for them, but might be willing to try new things like you have to offer for the sake of their children too, to help their children have better health than they've had themselves. So thank you for sharing the information today. Appreciate it.
Yeah, of course. And I did want to address, I think there was a concern in the chat about food allergies, and just that's something that I think that would be a good addition to the cookbook, of just like if there was something that's in a certain meal, just making sure that we're aware of that when we write that recipe, that it's kind of on the forefront so that parents know, hey, this contains this potential allergen. So that there are certain recipes that they can maybe avoid if they do have a kid that does have that allergy as well.
And also another comment came in through the chat, says the Dollar General Cookbook is the best. So just you guys know you're getting a lot of love in this chat. So
Yes, and if anyone needs or would love access to it, I think we sent it out last time, maybe through the link that y'all got the Zoom from. So feel free to do the same thing. The link will remain the same because we just update it constantly, so it will take you to the same site as we update it. So feel free to do that as well if anyone is interested in it that's new.
perfect. I'll go ahead and make sure that it does go out for everybody. So I'll send it out through an email, and I will also upload it into iEcho, into the platform, so you'll be able to see that there too.
Awesome. Thank you so much.
Thank you.
Thank you. Oh yeah, I see lots of comments saying that they would love to see that the cookbook. They would love a copy. So like Kathleen said, she'll get that out to everyone after the presentation. Do we have any more questions, comments? All right. It was great discussion. I'm just going to go ahead and introduce our next, just a quick preview of our next ECHO session, which will take place on Thursday, August 28th from 12 to 1 p.m. Eastern Time. We're excited to welcome Adatella Louise Jacques. I'm sure I just butchered that, but we're happy to have her. She's an assistant professor in the Department of Obstetrics and Gynecology at the University of Florida, where she contributes to the University of Florida Health Maternal Fetal Medicine program with a strong focus on breastfeeding medicine. And she'll be giving an insightful presentation on hypertension and maternal health. So keep an eye out for the registration link and session reminders. And please feel free to share the information with anyone you think will be interested in participating next month. We'd love to get them signed up and on our presentation next month. And before we wrap up, I'd like to quickly highlight our Constellation Regional Collaborative team behind the ECHO series. Maxine isn't here. She's out on vacation. She'll be back next month. We have Kathleen, our program coordinator, myself, Samantha Murdaugh, our program evaluator, and Sylvia Coleman, our strategy consultant. Please don't hesitate to reach out to us. We'd love to connect and continue any conversations. Lastly, before we close out, we'd appreciate it if you would take a moment to complete our post-ECHO survey. That'll pop up once we end the meeting. It's just a quick 8 questions, and it'll help us improve future sessions. And if you're wanting to get that continuing education credit, the completion of the survey is required. So you can fill it out right now using the link, using the QR code, or like I said, it's going to pop up on your screen after we close up the meeting. Oh, do we have one more thing come through the chat?
We did. So Tracy would like to know, has there been any collaboration with local school districts, small farmers markets on weekends at schools, or the school garden clubs?
Okay, so yes, on the farmers market, that's kind of the snack sorting as well as what Sarah was doing with community health. Those were both for farmers market. So that's been kind of our big entry point in the last few months. And then the school districts ideally will be through that med elementary group that we mentioned. So that's a whole program designed by students at the University of South Carolina that after our last presentation, we've worked with them on trying to hopefully implement it this fall, where we'll go to different schools and kind of put on demonstrations about their different like body systems and how that pertains to healthy eating and future outcomes as far as career options as well. So it's a whole program that we're hoping to kind of start, and a part of that will be the Dollar General Cookbook and healthy eating. So those are kind of the main 2 areas that we're focused on right now.
Yeah,
Tracy says thank you.
in the ambassador program at Oxford, we've worked with the Oxford Community Market, which has a garden right behind the farmers market. And we'll have like maybe once a month, we'll meet up with children and they'll come to the garden and we'll be there too, like to explain to them, fruits and vegetables, and we'll walk around the garden and we'll harvest them together. So they have a farmers market there as well.
Tim, this is Don DePetti. I just wanted to tell you how thrilled I am to obviously see that you have connected with the USC students with the Med-Elm program. I'm delighted. I'm glad you found the collaboration useful, and I'm excited to hear more about that work, and in any way that we can help facilitate it. I'd like to challenge Constellation and myself and our leadership with the regional collaborative to help foster that collaboration in any way possible.
Yeah, I'm really excited for it. I wanted to take it on as my own at first, and then I had a professor at the school that kind of took me aside and was like, why don't you let the pediatrics side of the SHC, which is a whole another division of our group, kind of be the forefront of that, and we'll just play kind of a more supporting role so we can focus on other things that we're doing in the community and stuff. And so I'm excited to play that role, hopefully in the next couple of months as we get started. So
well, it's just wonderful to have heard that collaboration, and that it's a formative collaboration. So I'm thrilled. Of course, I'm biased and I'm prejudiced. That goes without saying. The other bigger organization, of course, and you're aware of it, and they've presented here as well in the ECHO series, is the statewide South Carolina Food Share program. That's at another dimension. et cetera. But nevertheless, it's useful to know that what they're doing and the leadership there.
Definitely.
Thanks, Dr. DePetty. All right. Any other comment? I don't want to cut off any other comments, questions. We still have a few minutes, so if there's anything else. Going once. All right. Thank you. A huge thank you again to Timothy and Sarah for a fantastic presentation, wonderful discussion, lots of great questions. We really appreciate all of it. We hope to see you guys at our next session on August 28th. Thank you to all of our participants. We appreciate you joining us today. We appreciate your time, your insights, and all the work that you're doing in your own communities. And we hope that you are able to take something that you learned today and use it in your own work. Like I said, we are excited to see you at our next session on August 28th. Thank you again to our presenters, our subject matter experts, and everyone for joining us.